Are there any advantages to being out of network or challenges of being out of network?
There's a reason why half of all mental health professionals don't accept insurance. One was insurance companies just not offering reasonable reimbursement for services. But I would also say right up there with that is the hassle and frustration of actually dealing with insurance companies to get whatever that reimbursement is. When claims get denied, and sometimes denied for no reason, it can be hours of your time to get those issues resolved. And when I've talked to colleagues over the years, it is actually maybe less about the reimbursement and more about the hassle of trying to deal with the insurance companies to get your payment. That is a bigger barrier for people to accept insurance. Those are very valid reasons, and especially if you're a solo practice or small practice, you just may not have the bandwidth to deal with insurance companies.
Yeah, I mean, time is one of our most valuable commodities in life, and especially if it's. I would say of the things that I would like to do with my time, talking to an insurance company might be the bottom of the list.
Right. Yeah, and the disadvantage of not being in network for a provider is it can be a slower ramp up to fill your schedule.
Right.
You may have more problems with collecting payments from your patients with what they owe. It just can feel wrong to be charging people high amounts of money for what in a perfect world people could use their insurance for coverage. This has been propagated for years in the mental health industry, and there's many factors that have resulted in this issue. If we had more practitioners willing to fight for appropriate reimbursement rates from insurance companies, and as technology gets better, it is getting a little bit easier to deal with insurance companies to get your payments. I think that would be better for the industry as a whole, but very complicated market and economic factors that go into play there.